everyone, my name is Alda Cahyaningtyas and I am going to be presenting about Haemophilus influenza meningitis. I'm going to start with the causative agent first. As the name suggests, Haemophilus influenza meningitis is caused by the bacteria called Haemophilus influenza. It's categorized into two, encapsulated and non-encapsulated. The encapsulated type is divided into A, B, C, D, E, and F subtypes, which is the 6 subtypes. And then these subtypes differ by their capsules types. The most powerful type is type B or HIB, which causes the meningitis. And then we're going to move on with the epidemiology. So with the vaccine that is already being administered to a lot of children, thankfully there is a decrease in incidence. The vaccine itself is a vaccine against Haemophilus influenza type B. The population that is at risk are children, especially unvaccinated children, and immunocompromised individuals. This is especially true in developing countries where the vaccine is unlikely to be available. For the modes of transmission, um, the Haemophilus influenza bacteria is communicable, or it is able to be transmitted to another person or transmissible. This makes it a communicable disease. To acquire Haemophilus influenza meningitis, the individual must have a state of nasopharyngeal colonization first. Haemophilus influenza, being a communicable disease, it is transmittable from person to person, which can happen through the inhalation of respiratory aerosols or through direct contact with respiratory tract secretions. Fetus can also be infected from their mother through amniotic fluid or contact with genital tract secretions during birth. And the meningitis can develop from the spread of infection. Usually it's from the lungs and then to the blood and then to the brain. For the virulence factors, Haemophilus influenza have several virulence factors. Capsule of the Haemophilus influenza makes the bacteria have this anti-phagocytotic property, which enables it to escape host immunity. And then pili mediates adhesion, colonization, and biofilm formation. And IgA proteases, which is a protein, helps the bacteria to colonize and invade the host by disrupting the protection that is provided by IgA that is produced by the host. And then adhesins help the bacteria to bind to different specific receptors of the host cells and act at different stages of the Haemophilus influenza invasion. And we have established that the bacteria can form biofilm. So, as we have probably have learned from previous chapters, biofilm protect the bacteria from environmental and host and chemical stressors and can enhance bacterial virulence and resistance. And then there are several diagnostic techniques that can be done in order to confirm the diagnosis of Haemophilus influenza meningitis. I'm going to start with lumbar puncture first. It is also called spinal tap. This is done to test the spinal fluid for its protein, glucose, and white blood cells level. It is also able to be used to detect the presence of the bacteria. And in cases where lumbar puncture is not doable, it can be alternated with or substituted with blood culture. It is also done to see or detect the presence of bacteria and assess the level of white blood cells. However, when lumbar puncture can be done for that patient, it is advisable that blood culture is done on top of it. And then to confirm that it is the Haemophilus influenza, gram stain technique can also be done by using sputum And sputum is essentially is a mixture of mucus and other matter that is coughed up by the lungs or from the lungs, and can be used as a sample to perform gram staining under microscope. The bacteria is gram negative, so under microscope it will show as pink. And then since meningitis affects um, mostly the cranial area, it is essential to perform CT scan of the head. This provide imaging of any brain shift that might happen, lateral shift of midline structures due to the meningitis. Um, Additionally, it also provides images of the damage of enlargement of ventricles and effacement of cerebrospinal fluid. The image here on the right shows us the pediatric case with bacterial meningitis with intraventricular abscess. And lastly, chest x-ray might also be ordered by a provider in the case that they want to assess if lung infection is present. And for the prevention of this disease, as previously mentioned, vaccination already exists, and this vaccination is against the Haemophilus influenza type B, subtype B. The children that can get vaccinated, they need to be at least 24 months old. In cases where they may have more exposure to certain risk factors, um, children as young as 18 months old can also receive the vaccination. And there is also prevention plan for family members who have an individual of that family member infected with the HIV, which is by the use of rifampin. So rifampin is given to those family members except for pregnant women. So pregnant women cannot receive rifampin. And then it is best to maintain good hygiene practices, not only for potential risk of infection of this particular bacteria, but also for any other diseases in general. For example, by wearing mask when you go to the hospital, by maintaining good hand hygiene, by washing your hands, brushing your teeth, and things like that is the best method to prevent any bacterial or microorganism infection. And then the treatment of meningitis is, you can say, quite extensive. So, firstly, antibiotics such as ceftriaxone can be administered. Um, so sorry, can be administered to these children that or any individuals that have the meningitis. It needs to be administered for at least 7 days. Really depends on the situation and the assessment of the provider or the healthcare professionals. And then on top of that, if inflammatory responses is observed, it is essential to also be ordering corticosteroids such as dexamethasone. In the case where respiratory stress is observed, um, the patient might also need oxygen mask, also nebulized epinephrine. Where meningitis have further developed into a more advanced stage, then surgical drainage might be needed. And this is needed when subdural and pleural effusion or empyema is present in the patient. And this is the sources of my presentation for today. Thank you so much for watching. Bye bye.